Welcome to open enrollment for your employee benefits program. Your new plan year will begin November 1st, 2017, and we want to be sure that you have all the information you need to make informed decisions about your benefit choices. Before we begin, let's review some key information about this year's open enrollment. Our new medical plan provider will be Anthem Blue Cross Blue Shield. Employees will need to complete a benefit election form and turn it into Human Resources as soon as possible, no later than October 26th. If you currently have our SummaCare medical coverage and you do not turn in an election form, your coverage will transfer to Anthem in the corresponding plan that you are enrolled in SummaCare. All benefit elections and changes will take effect November 1st, 2017. Open enrollment is your opportunity to enroll for benefits for the first time, make changes to your current benefit selections, add or delete dependents, or add a new type of benefit to your selected package. You can sign up for benefits after completing your new hire waiting period, during the annual open enrollment period, or within 30 days of a qualified family status change. Qualified family status change events include marriage, divorce, or legal separation, birth or adoption, losing members of your family, a change in your spouse's work status, receiving a qualified medical child support order, or a change in your child's eligibility for benefits. If you need to make a change to your benefit plan due to one of these life events, you must inform your Human Resources within 30 days of the event, or you will miss your chance to make changes until the next open enrollment period. Now let's talk about your medical coverage. Let's start with some commonly used terminology so the rest of this information makes more sense. For this presentation, we will focus on in-network benefits only, since using in-network benefits is the most cost-effective way to access your plan. You're free to access out-of-network providers, but they will be more expensive. Copay. This is a flat dollar amount that the member is responsible for at the time of service. The plan usually pays 100% of the remaining balance. Deductible. This is the amount that the member is responsible for before the plan pays for certain services. Coinsurance. This is the percentage of payment shared between the member and the plan for certain services after the deductible has been met. Out-of-pocket maximum. This is a member total payment for deductible, coinsurance, and co-pays to stated maximum per plan year. Once reached, the plan will pay 100% for eligible expenses for the rest of the plan year. In-network provider. This is medical and pharmacy providers that have contracted with Brewster Park and Bel Air Care Centers offer two excellent medical plan choices through Anthem Blue Cross Blue Shield. Preventive care, also known as your annual physical, is covered at 100% with no deductible and no copay for both medical plans. We encourage all employees to receive annual preventive care with their primary care doctor. If you need to see a doctor for something other than preventive care, then copays apply. Copays are generally used for common items. Whenever you see a copay in your plan summary, it is not subject to your deductible. Both of these Anthem medical plans, which is the base and the buy-up, have a copay for a primary care doctor of $30 and a specialist of $60. If you have a more serious issue, the next best choice for you might be an urgent care center. On both plans, the urgent care copay is $75. If you have a true emergency, then an emergency room is the appropriate place to go. The copay with the base PPO plan is $350. The copay for the buy-up PPO plan is $300, then 20% of the allowable billed charges. Emergency rooms are very, very expensive places to receive care, and so we encourage you to consider one of the other alternatives if your situation is not a true emergency. All items that are not listed as co-pays will be subject to deductible, coinsurance, and out-of-pocket maximum. Your base PPO plan will have an annual deductible of $5,000 for single and $10,000 for family. After reaching the deductible, the insurance will pay 100% coinsurance up to an employee out-of-pocket maximum of $7,150 for single and $14,300 for family. Your buy-up PPO plan has an annual deductible of $2,000 for single and $4,000 for family. After reaching the deductible, the insurance will pay 80% coinsurance up to an employee out-of-pocket maximum of $4,500 for single and $9,000 for family. This is a reminder that Brewster Park will continue to administer the Health Reimbursement Arrangement, or HRA. Once the employee reaches $2,000 in deductible, Brewster Park Bel Air will reimburse $1,000 if the employee submits an explanation of benefits to Human Resources. The reimbursement is provided by Brewster Park. It is not administered by Anthem. You must submit a claim form along with a copy of your Anthem explanation of benefits to Human Resources. This slide provides co-pays for the retail and mail order prescriptions for your Anthem plans. This information is also provided in your benefits summary on page 4. Remember, you should never pay more than the normal price at your pharmacy. So if you're purchasing $4 generics at Walmart or Giant Eagle, you should never pay more than $4, even with your Anthem card. First-tier generics are a $10 copay, preferred name brand are $40, non-preferred brands are $70, and specialty medications are 25% up to $350. Retail is for a 30-day supply. Mail order first-tier generics are $20. Preferred name brand is $120. Non-preferred brands are $210, and specialty medications are 25% up to $350. Mail order is for a 90-day supply. To determine the tier level for a specific medication, please check the Essential Prescription Formulary on Anthem's website. Just a reminder that preventive care is 100% covered on both of your medical plans. On this slide is a list of some of the routine preventive screenings for children and routine preventive screenings for adults based on gender and age. However, for a comprehensive list of routine services, please contact Anthem Blue Cross Blue Shield. Contact information is provided on page 21 of your benefit summary. So, what plan do I choose? Here are some things to consider. Review your prior year's medical expenses. Review your total claim cost and ask yourself these questions. Do I anticipate any surgeries or hospitalizations for me or my family in the upcoming year? Do I prefer a higher deductible with a lower payroll deduction? Am I prepared to pay the higher deductible in case of an unexpected medical event? How can you maximize your benefits? Ask yourself these questions. Am I using in-network facilities and providers? Do I know the urgent care facilities near my home for minor emergencies? Have I asked my doctor or pharmacist for lower cost prescription alternatives or shopped around pharmacies for lower prices? Has my family and I had our annual preventive services performed? Do I know where I stand regarding my deductible and coinsurance before services are received? Have I checked my explanation of benefits to compare it to provider charges? Now, let's take a few moments and review your dental benefits. Dental insurance can help lower your out-of-pocket expenses so you and your family can maintain healthy smiles and better overall health too. We have chosen a dental plan with Anthem Dental that will give you plenty to smile about. The group dental plan is administered by Anthem and has a PPO network available to help you save money. You have the freedom to select any dentist, but you pay less out of pocket when you choose an in-network provider. With this dental plan, you have superior access to care as well as reduced fees through agreements and participating dentists. Plus, you cannot be balance billed with the participating provider, giving added savings. Preventive services are covered at 100% and the deductible is waived for preventive. Basic services are covered at 80% after the deductible, and major services are covered at 50% after deductible. Orthodontia services are covered at 50% for children under the age of 19 up to a maximum benefit of $1,000. Remember, by using an in-network dental provider, you will save money. You may locate a dentist online at Anthem's website. Their contact information is on page 21 of your enrollment guide. Now let's talk about your vision coverage. Vision insurance plans are designed to keep your eyes healthy. Eye doctors can detect signs for health conditions such as diabetes and high blood pressure before symptoms arise. Coverage includes low copays on eye exams, eyewear, as well as allowance and discounts on frames. With iMed's large vision network, there's always a provider in sight. Your vision benefits carrier is iMed. You have a $10 copay for exams at a network provider, and exams are covered every 12 months. You have a $20 copay for eyeglass lenses, which are covered every 12 months. You will have a retail frame allowance of $135 toward the purchase of any frame at a network provider. For frames that exceed your allowance, you may receive an additional 20% discount on the overage at a network provider. This allowance is offered every 24 months. In lieu of eyeglass lenses or frames, you may receive a contact lens allowance of $135 and a 15% discount over $135. This allowance is every 12 months. Now let's discuss the enrollment process. All employees need to turn in a benefit election form to Human Resources. If you're currently enrolled in the SummaCare medical plan and do not turn in an election form, your coverage will move to Anthem as you're currently enrolled today with SummaCare. You should still submit an election form to Human Resources, though, for this plan year. No benefit enrollments or changes will be accepted after the open enrollment period unless due to a family status change or a qualifying event. If you're newly hired, open enrollment for you will be limited to the time around your hire date and the date that your benefits become effective. Consider these final recommendations to maximize your benefits and your health. Get your annual checkups, medical, dental, and vision. Discuss generic prescription equivalents or alternatives with your doctor. Use the nurse line, toll-free, 24 hours a day, 7 days a week. Avoid the ER. Visit urgent care centers. Utilize mail-order prescriptions. Log on to www.anthem.com to access tools. Request pre-authorization and estimates. Thank you for attending today's presentation. We wish you and your family a happy and healthy 2017 plan year.